Now that GMA exclusive, the FDA has just approved a breakthrough cancer drug that could help thousands of people every year. It's already giving hope to a family who thought they were out of options for their 9-year-old son. And Ariel Reshef is here with this encouraging story.
Very encouraging, a breakthrough here, Robin. That cutting-edge technology has only been administered in trials, but it was just approved by the FDA within the last 24 hours. And experts say it could save more lives like Ashton's as soon as it hits the market.
Looking at energetic, athletic 9-year-old Ashton leads, you'd never know just 5 years ago his chances of surviving cancer were bleak.
When Ashton was 4, I noticed a lump on his neck. We took him in to see his doctor. Ashton was sent for a biopsy where they found out that he had stage 4 thyroid cancer.
His diagnosis dire and devastating to his family.
Slowly we noticed his breathing change and he kind of lost some weight, and so he went back to see his doctor, and they did another chest x-ray and it showed that the cancer had spread in his lungs.
He would undergo surgeries and treatment, but that didn't stop the disease from progressing.
The worst moment was probably seeing him after he had his surgery and seeing him hooked up to all the machines.
Doctors said there was nothing more they could do.
They did some testing and they found out that the cancer had become resistant. But we didn't know, how long Ashton had after that.
Until a phone call last spring about a trial for a cutting-edge new cancer drug changed everything. The medication will be sold as Vitrakvi, or larotrectinib, the generic version just approved by the FDA, brought to the market by Bayer. It targets a specific genetic mutation found in certain kinds of cancers. The drug inhibiting the protein that's responsible for cancer growth in these tumors.
Larotrectinib actually specifically targets a change in the DNA of the tumor cells for these specific cancer types.
The leads driving 700 miles every month from their home in Alberta, Canada, to Seattle Children's for the treatment. The results for Ashton, stark.
This is his most recent scan, and basically almost everything is totally gone. But as you can see, the difference is night and day.
When you find a patient that has the mutation that this drug targets, it works almost every time.
It could provide new hope for thousands like Ashton.
This medication has been the best thing that's happened to us, in the last couple of years, and it really does, give us hope for Ashton's future and that, everything's going to be okay.
It's all looking up for Ashton, and while he is not considered completely cured, his prognosis is very promising. He will continue taking this drug as long as doctors are monitoring his progress, but his family says, Robin, his response to treatment certainly is a good reason to be hopeful.
Great to see his smile and that of his family.
Certainly.
Ariel, thank you as always. Dr. Jen Ashton is going to talk a little bit more about this.
Yeah.
So how exactly does this work?
Let me show you, Robin, because it sounds confusing. I want you to think of it this way. Think of this mug as our DNA. We have a gene that codes for a handle, gene that codes for the lip of the mug, the side, the bottom, and so forth. This mug now, there's been a clean break in the gene, okay? And when the gene heals itself, which DNA does, it comes on in a completely wrong way, wrong place. The drug works here to block this defect. This is what causes the cancer. It's called a TRAC fusion inhibitor, this class of drugs. Now, it's not for everyone. This drug is for kids and adults with locally advanced cancer that has not responded to other treatments, so they're kind of out of options. And when you talk about numbers, we heard Ariel say it, unfortunately, only about 1% of all cancers have this particular genetic mutation. But for that 1%, this is a big deal. This is precision medicine, targeted therapy.
And maybe we can even learn from this.
Exactly.
Okay, so what are the caveats here and the side effects?
Okay, always caveats. First of all, this big trial, which is called the Navigate trial, was partially funded by Bayer, who makes this drug. The cost is to be determined. Usually we're looking at a very high cost. It will remain to be seen whether insurance will cover it. And then side effects, always side effects when you talk about treating cancer. Fatigue, nausea, digestive systems. It can bump up your liver enzymes, which are our blood tests, but generally these side effects are pretty mild.
You talk about precision medicine. It makes me think of Memorial Sloan Kettering here. They're on the cutting edge when it comes to that.
That's right.
How do people find these clinical trials and other?
That Memorial Sloan Kettering has a statistic that only 35% of Americans would enroll in a clinical trial, largely because of fear. They don't have the right information. There are a lot of myths and misconceptions. I want everyone listening to this, regardless of what kind of cancer you have, you can go to clinicaltrials.gov. Every clinical trial in the world must be registered there. You can put in the type of cancer you have, where you live. For this particular drug, you can enter in LOXO-101 and find out where this drug is being tested in the country. But this is the backbone. If you want to get involved in a clinical trial, educate yourself. It can make all of the difference.
Bless you for sharing that very important
It's
information.
so important,
All
Robin.
right, Jen,
Thanks.
thanks so much. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.